Hello, I'm Dr. Douglas Dietrich, Professor of Medicine at the Icahn School of Medicine and the Director of the Institute for Liver Medicine at the Mount Sinai Health System. Hepatitis C is an infectious disease that's transmitted mostly by blood-to-blood contact, that is by sharing needles or by transfusions, or people who got transfusions or gamma globulin or blood products back before 1992. Mostly now there's a new epidemic of young folks using heroin and sharing needles. So it's spread almost exclusively that way nowadays. You probably heard in the news that sort of goes along with the epidemic of overdoses in the US. It's a simple blood test. It's important to realize, though, that when you go to your doctor for a regular checkup, hepatitis C testing is not part of it, so don't assume that you've been tested. If you've had a regular checkup, you have to ask specifically to be screened for hepatitis C. But yeah, actually, it's been wonderful news for those of us who want to eradicate hepatitis C. The World Health Organization has a big campaign to eradicate hepatitis C in the world, which we can do now since we have medications that can easily treat it and cure it with as few as 56 pills. Both the U.S. Public Service Task Force and the CDC now recommend hepatitis C testing for anyone 18 years of age or older, regardless of risk factors. The most common symptom is no symptom. Otherwise, the second most common symptom is fatigue. There's usually not an acute jaundiced episode with hepatitis C, just some fatigue. And so that's why it's recommended that just everyone be tested, because it's really hard to, there's no sort of definitive obvious symptom. Well, as I mentioned before, those people who have, who are using drugs or sharing needles or have shared needles in the not too distant past, or those baby boomers actually who actually shared needles or shared straws using cocaine back in the 80s. So we've got like three major groups: the baby boomers who used heroin back in the 60s and 70s, the Generation Xers, I guess, who used cocaine in the 80s, and our new generation Y and Z who were injecting drugs now using IV heroin, which I hear is actually increasing during the pandemic. All of those folks are at risk, or anyone who got a transfusion or blood products before 1992. Oh, it's quite common. We pick up a lot of the new of the new disease, and sometimes because of the advertising on TV for the medications. We actually have people coming in, baby boomers, who kind of knew they had it for many years, and then they saw the advertisements on TV, and they come in and they realize they can be cured of the disease quite easily with really virtually no side effects. No vaccine, and it looks like it's pretty unlikely to develop a vaccine. There are a couple of clinical trials, but so far nothing good. The good news is there's two drugs available. They're both combinations of drugs. One is for 8 weeks, 3 pills a day for 8 weeks, and the other one is 1 pill a day for 12 weeks. Both have minimal side effects and close to 99% cure rates, which is spectacular nowadays. And even for those 1% that fail, we actually have a plan B, a rescue therapy available as well. So we can pretty much cure everybody. Good question. Frankly, I don't think everybody should be screened for hepatitis C alone. I think everybody should be screened for hepatitis A, B, and C. Actually, most public schools and colleges insist on screening for hepatitis B and vaccination if the patients are negative. That's a sexually transmitted disease, pretty much. Although it doesn't have to be sexually transmitted, it's incredibly infectious, and just household contacts, kissing, hugging, sharing dinnerware can transmit hepatitis B. Hepatitis A is also easily transmissible. It's fecal-oral transmission. So it's also spread person to person or from water that's contaminated, but mostly person to person. So it's both A and B are prevented by vaccines, and the vaccines are highly efficacious. And actually, all of our kids now are getting vaccinated for hepatitis B at birth, and then hepatitis A shortly thereafter. So I think everybody should be tested for A, B, and C, because the older folks now probably did not get vaccines for A and B unless they were traveling somewhere. So we can prevent those infections. A never becomes chronic, so we don't have to worry about treating that. B frequently becomes chronic in younger folks. So we have medications that can treat hepatitis B, although it's actually one of the major causes of liver cancer in the world nowadays. So it's really important to be tested for B as well. It doesn't look like there's that much difference in the prognosis, although patients who have cirrhosis from hepatitis C do much more poorly when they get infected with COVID-19. As you'd expect, since their health is so poor to begin with, and it can cause worsening of their liver disease as well as all of the other COVID-19 symptoms. Well, I think particularly if you've got liver disease already and you know about it and things are getting worse or changing, you should go get tested for COVID-19, because sometimes COVID-19 can cause patients with chronic liver disease to decompensate, they call it, or worsen. So we should have a high level of suspicion for COVID-19 if anything is going south in people with pre-existing liver disease. We've been actually instrumental in developing the medications to cure hepatitis C. We actually are working on several clinical trials now for experimental medications to actually cure hepatitis B. So far, it's not been curable, just treatable. Not much to do for hepatitis A. We have a very robust program in liver cancer, both trying to prevent it, screening to find it early, and treating it when we find it. That's a wonderful group of navigators and coordinators that help our patients access insurance plans, help them navigate themselves through the medical system. They actually will even physically escort them to their clinic visits if necessary. They'll arrange transportation, and they'll make sure that the medications get delivered to the patient's home or to the clinic, whichever makes it easier for the patient. So it actually is a huge help to our success rate in curing virtually all of our patients with hepatitis C. Yeah, I think it's a huge opportunity to make people aware that hepatitis C testing is now recommended for everyone, age 18 and above, regardless of risk factors, because some people don't remember or don't admit, or et cetera, et cetera. So I think we should test everybody for hepatitis C. And a lot of people think we should be doing hepatitis B testing at the same time, as well as hepatitis A. So if you come to our group for hepatitis C testing, we'll test you for A and B also, and we'll vaccinate you if you're not immune to A or B. Or if you have B or C, we can treat the B and cure the C. I think it's really important that even if people don't have symptoms from hepatitis C or hepatitis B, that they're both silent killers. Hepatitis B can produce liver cancer without any scarring or perceptible liver disease. Hepatitis C progresses to cirrhosis. It can be as quickly as 5 years. And it also causes liver cancer and has no symptoms. So it would be foolish not to be tested, because we can cure C, treat B, and prevent liver cancer, cirrhosis, liver failure, and death nowadays very successfully.